Autism and fever are similar. Want to know why? Watch this video. Hello everyone and welcome to the channel where we endeavor to educate, equip, and encourage anybody raising a child with a special health care need. I'm Dr. Noble. Let's get started. Imagine this. You take your newborn beautiful baby to the emergency room because the baby's not eating. And the baby's flappy and you feel the baby's head and it feels warm and you're not sure what's going on, but you're scared. You go to the emergency room, you get into a room, they do a bunch of evaluations, the doctor walks in, sits down on the bed and says, "Don't worry, I know what's going on. I figured it out. I've looked at the vital signs. Your child has a fever. So don't worry about it. Go home, take some Tylenol, all will be well." If you're me, you're asking, fever? What? Why has the baby got a fever? Fever is a symptom. Fever is a symptom that reflects something else that's occurring. Maybe it's a urinary tract infection. Maybe it's an ear infection. Maybe it's meningitis. Autism is similar to this in that it is a symptom. It is a feature. Now that doesn't always mean that we can figure out exactly what has caused the diagnosis of an autism spectrum disorder, but it means that we should try. There are innumerable amounts of genetic conditions that have autism as a feature. Why does that matter? That's what this video is about. During our time, I want to submit to you 3 deliverables. The first of which is, I want you to understand why you should even consider genetic testing in an autism diagnosis at all. Like, why would you even think about it? Number 2, I want you to think about who is it that actually does this type of testing? Like, who do I go and see and what should I expect? And lastly, I want you to understand what this genetic testing consists of. I want you to be educated. I want you to know what to expect and know where you are in the story. We must begin our time by underscoring the importance of a medical evaluation. As I said earlier, autism is a feature, it's a symptom, and that doesn't mean that we always figure it out. But what it means is that there are several conditions implicated and they should be assessed. Autism is genetic until proven otherwise. There are 5 reasons to consider conducting genetic testing on an individual with an autism diagnosis. Number 1, it ends the diagnostic odyssey. What does that mean? It means that if we know what the diagnosis is, we know what the diagnosis is not. If we know what the diagnosis entails, then we know what it does not entail. We know if there's kidney issues, we should look for them. We know if there's cardiac issues, but if we know that there's not issues in those organ systems, we don't have to keep searching or shaking the bushes. We just focus in on the known features and symptoms of the condition and we move forward. Now, we're not looking at other organ systems unless there's good reason for it. Number 2, a genetic diagnosis connects you with both a people group and with research. Right now, around the world, there are people gathering around tables and meeting together on Facebook groups because of a genetic condition, a description, a name. And without a diagnosis, it's difficult to connect with those people. Now, are there plenty of people groups and are there plenty of parent groups that are available for individuals with an autism diagnosis? Yes. But as I've said earlier, there may be more specific subgroups that have autism as a feature of an underlying condition that you would be able to easily connect with if you knew the diagnosis. Not only that, but it also opens doors for you to participate and connect with specific centers that care for specific genetic conditions and conduct specific genetic research around a genetic diagnosis. Next up, meaningful surveillance. Listen, if I was in a car with you and we were driving to a football game 3 hours away and I could tell you that 2 hours up the road there was an accident and that we should take an off-ramp and go around it, you would be thankful because then you won't be stuck in traffic and miss the game. Meaningful surveillance means that we know what potential problems could occur based on the genetic diagnosis, and we can go and look for those problems before they cause problems. Should we screen for kidney disease? Is there risks of early onset diabetes? Is there a lowered seizure threshold? Is there a cardiac abnormality? Knowing a genetic diagnosis tells me where to look and what to look for. Next up is to quantify recurrence risk. Knowing a genetic diagnosis allows us to quantify recurrence risk. It allows me to tell a family the likelihood that this condition could occur in another pregnancy. This matters because most of my patients are young. The parents were born the year I graduated high school. They're just starting their family. Just because I'm done having kids doesn't mean that they are, and they want to know what's the likelihood of recurrence. I can't tell them that with any degree of certainty without a known genetic diagnosis. And lastly, and potentially most important, a genetic diagnosis that helps us explain the presence of an autism spectrum disorder allows me as a provider to conduct, with exacting surgical precision, the removal of needless, senseless, worthless guilt. Now, I know you're thinking, why would anyone feel guilty? I mean, of course it's not their fault, but most people that I see in the clinic find novel, creative, impressive ways to feel guilty. Maybe somebody had a bad attitude in the delivery room. Maybe somebody smoked a cigar two states away. Maybe they walked under a power line during pregnancy. They find ways to feel terrible about whatever struggles their child may be experiencing, and when I can show them with certainty the root cause of their child's autism spectrum disorder from a genetic perspective, I can say to them, listen, you're powerful people, but you're not powerful enough to cause this. This is the change that you didn't get to choose for your child. And by doing that, it often is a dramatic way to alleviate guilt. Next up, let's talk about who does these types of evaluations. If I've convinced you thus far that a genetic assessment for a child with an autism spectrum disorder is necessary, who do you go and see to do that? Well, there's three groups of people in general to consider, the first of which is a neurologist. A neurologist is very strategically placed not only to assess for seizures, but neurodevelopmental disorders and delays, and which would often entail genetic testing. Certainly, a geneticist would be the second category. Geneticists are in the name, know genetic stuff. I am one, and I will tell you, we know genetic stuff. And we're very specific and strategic on the approach as it relates to an autism spectrum disorder. And lastly, a developmental and behavioral pediatrician. These are individuals who not only can conduct the necessary genetic evaluation, but can diagnose the autism spectrum disorder and coordinate the care necessary to ensure that child reaches their full potential. Lastly, let's talk now about what do I mean by genetic tests? What exact genetic tests are we discussing? I want you to understand these and know what to expect. To begin, the first genetic test that we're going to conduct is a family history. I know, spoiler alert, there's no blood, there's no urine, there's no studies, there's no lab, there's no prior auth. It's just a family history. Why is this important? Let me tell you a story. A long time ago, early in my training, I met a wonderful family who were referred to me because they had a child with an autism diagnosis. They referred them to me for an assessment and to coordinate care, but also to conduct genetic testing. As I was conversing with the family, I had several questions about their family history. One of the family members was not there. The family member that was present said, I think that Dad may have had some stuff with his colon. I don't really know. I know they had to take it out. I can't really remember. I'm not sure. So I say, okay, Dad finally comes to the visit later. I asked Dad, tell me a little bit more about your family history. He goes, oh yeah, when I was younger, I had a bunch of growths in my colon and they had to remove it. And they said, you know, that I'd be okay, but I could have cancer or something at some time. And I said, whoa. Do you mean did they tell you have familial adenomatous polyposis? FAP? And he goes, yeah, that's it. That's what they told me. And I said, sir, do you realize that's a dominant condition with a 50% recurrence risk? That every child that you have has a 50% chance of inheriting the same condition? I said, sir, tell me that this child has seen a GI doctor. Tell me that this child has undergone a colonoscopy. Tell me that you are still seeing a GI doctor and participating in the necessary surveillance so that you don't get colon cancer. Family history is important, and it's the cheapest and easiest genetic test that anyone could ever get. So when you go to an evaluation, please know that you should have your family history ready. Ask people what's going on with their kids, what went on with Ethel, how did Grandpa die again? Try and get information because those are clues that can help us know what to do next. Next up, prenatal history. I want to know everything. I want to know about, it's your first, second, third pregnancy. Have you had any pregnancy loss? Have you had recurrent pregnancy loss? Did you have any trauma during pregnancy? Any fevers? Did you drink any alcohol? Did you do drugs during pregnancy? Listen, Having traumatic issues or exposures to teratogens like drugs and alcohol during pregnancy are not developmental enhancers. They do not help kids get to Harvard, okay? And I need to know these things because they could contribute to the child's neurodevelopmental state. That doesn't necessarily mean that they're entirely responsible, but it's possible that they're contributing to the diagnosis, and I need to know the contributing factors. Next up is physical exam. Now listen, we still have not drawn any blood, but this is the point when we use our eyes, we use our ears, right? We use our hands, and we do what doctors do. We look at people and we try and synthesize information and look for additional clues. What am I looking for in a physical exam? A lot of stuff. Light or dark spots on the body, low set ears, wide spaced eyes, thick necks, scoliosis, multiple things that you can detect when a seasoned clinician looks at your child. Light or dark spots on the body can be indicative of an underlying neurocutaneous disorder like tuberous sclerosis or neurofibromatosis. There can be any number of clues that are discernible on a physical exam. Why is this an important point? Because there are a lot of people who diagnose autism. Not all of them are physicians, not all of them are subspecialty physicians. And while it's important to have a lot of skilled people diagnosing autism, it's also important to have a lot of skilled people who know how to assess autism, how to think about it from a genetic perspective, from a medical perspective. There is a lot more that goes into an evaluation for an autism spectrum disorder than a sticky note that goes on the head that says autism. There's a whole bunch of other stuff to think about from a medical perspective, from a care coordination perspective, and from just an overall family perspective. You need to be told in no uncertain terms, this child is going to make great progress and they will be blessed in the community and they will bless the community in return. They're going to have a rich, full, and beautiful life, but we have to make sure to get rid of any confounding factors like genetic conditions that could hinder their progress. Now, one last thing before we talk about the specifics of the genetic assessment, and that's the preliminary laboratory studies that should have been done by your primary care provider. Example, thyroid. If a child's got developmental delays, they should have their thyroid checked. They should have their lead level checked. They should have a CBC, a CMP to look for liver health and make sure they're not anemic. You should look for basic general underlying health-related issues that can easily be assessed by your primary care provider. These are important points for you to know, but beyond the scope of this video. Now, let's get into the first and maybe the most important genetic test, a chromosomal microarray. Now, rather than worry about what's the name of these tests and what are they blah, 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 and the mechanism, what you need to understand is what they look for, okay? A chromosomal microarray does not look for a specific genetic condition. It looks for a specific genetic mechanism, okay? And this test is used first in almost all situations because it looks for gains or losses of genetic material, too much or too little DNA. On the macro scale, meaning buildings of DNA have been duplicated or deleted, and the micro scale, meaning somebody deleted a chair out of a room or somebody deleted the Manhattan Deli. Well, the reason that this is the first test we do is because we've learned over the last 2 decades that a large percentage of individuals who present with neurodevelopmental disorders, it's due to gains or losses of genetic material, which is why we look here first. This study can be done on blood. It can be done on a buccal swab, which is a cheek swab. There's many different ways to access the DNA necessary to conduct this test. It takes about 4 to 6 weeks to come back. It is usually covered by insurance because it's widely understood to be evidence-based best practice and dictates medical care. Next, let's talk about Fragile X. Fragile X syndrome is a single gene disorder. This is a test that we use to look for a specific genetic condition called Fragile X syndrome. This is the most commonly inherited form of intellectual disability and almost always has autism as a feature. Family history of individuals with Fragile X syndrome looks like this. It's individuals with premature ovarian failure, infertility, and early onset Parkinson's disease, but they also could have ataxia, which is a lack of coordination in regards to gait, and tremor, which is a fine motor shaking of the hands. If you see these kinds of things in an individual or an individual's family, Fragile X syndrome becomes a concern. These individuals tend to present with large head size, a long stretched out face, and large ears. Okay, the reason why this is important is because it has an increasingly high recurrence risk. And there are additional family members who likely carry this condition, maybe in a pre-mutation state, who could then pass it on to other children, or they have relatives who could pass it on to their children. So diagnosing this condition is increasingly important. A couple other single gene disorders that bear mentioning and should be considered in the evaluation of an autism spectrum disorder is the MECP2 gene, which is on the X chromosome. So it's X-linked MECP2, and that is associated with a condition called Rett syndrome. When you consider sequencing this gene, when you see a female present to the clinic with a small head size, wringing of the hands, and developmental regression. So they're losing their developmental skills, particularly as it relates to speech and language. This condition is assessed for by sequencing the MECP2 gene, and it should be considered in any female presenting to the clinic with an autism spectrum disorder. Another single gene disorder to consider is PTEN, which is PTEN. The PTEN mutation, or the PTEN gene, is important to detect because it presents with hamartomas. And hamartomas are growths that can occur in the colon that can in turn become cancerous. Now, there are a number of conditions associated with mutations in the PTEN or the PTEN gene, but one of the things to consider in these conditions is the hamartomas, which, as we've said, can cause cancer. These individuals present with a large head size and an autism spectrum disorder. When you see this constellation of features, think about sequencing the PTEN gene to ensure that you rule out and assess for the risk of cancer. Next up is whole exome sequencing. Now, this is a study that's different than the chromosomal microarray, which we talked about earlier. I'm not really looking for gains or losses of genetic material. I'm looking for variations in the sequence. Think about it like this. You and I go into a library. We go to the section of books that we're looking for. We pick up a book, and we make sure that every book in that section is accounted for, and every page in every book is appropriately marked and in order. Nothing's been ripped out, nothing's been put upside down, everything makes sense. And what we do with an exome sequencing study is we do that thing simultaneously with disease-causing genes that are associated with your child's presentation. So in this situation, in autism spectrum disorder, we simultaneously interrogate thousands of genes looking for changes that could impact their function and result in a condition that has autism as a feature. This study takes longer, think about 2 to 3 months. Often this can be covered by insurance as well, but these vary depending on where you live and what kind of insurance you have. But this is also widely considered evidence-based best practice because it's medically necessary to direct care. Next up is metabolic testing. Now, metabolic testing is really a collection of conditions that we're going to term metabolic disease. Now, the reason why this is lower on the list and towards the end of our time today is because these are increasingly rare. Metabolic diseases often present with developmental regression, and not just of speech and language, but regression of everything. So think about you're losing your ability to swallow, you're losing your ability to see, you have kidney difficulties, you have liver difficulties, you have heart difficulties. Everything is malfunctioning. Things are shutting down. This can happen quickly in the newborn period, but it can also happen over several years and be very slowly and regressive. Individuals can have changes in their physical appearance, such as coarsening of their facial features. These are things to consider, and you can find these conditions on an exome sequencing study, as we just discussed. You can also find them by looking for various metabolites in the body, but keep in mind that these are not first-tier evaluations because they're increasingly rare. Less than 1% of the time do they contribute to the diagnosis of an autism spectrum disorder. What about neuroimaging? Let's talk about neuroimaging. Why don't we just do an MRI? If we did an MRI on every child, which is 1 out of 36 children in America, that's a lot of MRIs. Not only does it not make sense from a cost standpoint, it's also important to be reminded that an MRI is often not necessary. Now, if a child has a decreased level of consciousness, if they have concerns for a seizure disorder, then absolutely we would consider an MRI of the brain. But by and large, an MRI doesn't direct care unless there is a focal neurologic lesion that I've detected on physical exam and and that I want to interrogate further with imaging studies. What about an EEG? That's the study where we look at brain waves to determine whether or not there's seizure concerns. Now, this is almost exclusively done by a neurologist, and oftentimes we don't do this unless there are concerns for seizure. Autism in and of itself is not enough information to conduct an EEG. The likelihood that we'll find something useful that could direct care is negligible. Let me give you a brief disclaimer. We've spent a lot of time together. I want you to understand that while I'm a doctor, I'm not your doctor. If you have concerns, go to your physician and ask about these things. Please don't confuse a YouTube video with a doctor's visit. If you'd like more information on how to tell the difference between autism and ADHD or both, if the use of CBD is something you should consider in an individual with autism, or a variety of other topics in regards to ADHD, please check out other videos on our channel. And lastly, if you'd like to interact with us more personally, we do live videos every week, so please stay tuned, like, and subscribe so that you can get those notifications and have the opportunity to give us your questions in real time. Thanks, and I'll see you in the next video.